I'm Dr. Matthew Fay. I'm a GP with Affinity Care PCN and a PwSI in Cardiovascular disease and Anticoagulation. Today I'm going to discuss the assessment of those with blood pressure issues in a health system with restrictions due to COVID-19. These are my normal declarations of interest for your information. In dealing with cardiovascular risk, we have to address the situation in a many-faceted way. Lifestyle, of course, remains the bedrock of all preventative medicine, but also we should consider those who are smoking and offer support to help them stop smoking in a structured way. Today, of course, we're going to focus on hypertension and blood pressure assessment. Reducing blood pressure reduces cardiovascular risk. This is a linear association, and we know that if we reduce blood pressure in anybody, we will reduce their cardiovascular risk. Our real issue is trying to find those who will benefit the most. In a normal healthcare system, we have a fully fledged cardiovascular protocol, but during this time of restriction, we need to think about every contact the patient may have with the health service, and this may reduce the use of devices such as ambulatory care, blood pressure monitoring, so that we minimise the risk of contact for our clinicians and healthcare workers. Looking at blood pressure management in a time of COVID-19, we've come up with this pragmatic solution, and I will go through it step at a time. The first thing we need to know is, does the patient have established hypertension? If they have, then I will deal with that in an alternative presentation. If they don't, the first thing we want to know is what is their level of risk. If they've already got overt vascular disease, so they've suffered from heart attack or stroke, or are known to have coronary disease, carotid disease or peripheral vascular disease, and their blood pressure is being seen consistently to be greater than 135 mm systolic, then I would suggest that these should be coded and treated as hypertensive, as reducing their blood pressure will reduce their cardiovascular risk. If they are not known to have vascular disease, but are consistently showing blood pressures of 140 or greater and have multiple CVD risk factors such as type 2 diabetes, renal disease, high Q risk, familial hypercholesterolemia and such like, then I would suggest that at this level we would code these patients and treat as per the hypertension protocol. For those people with an elevated blood pressure but no associated risk factors, then these people will still require formal assessment with an ambulatory blood pressure monitor, and this will still need to be used in the normal way. I would suggest that these patients are lower risk than the categories we've already discussed, and the ambulatory monitor may be deferred until the restrictions of COVID-19 are lifted. If the blood pressure is acceptable, that does not mean we can remove all our intervention for the patient, because what we need to do is still discuss other lifestyle factors and smoking to reduce their cardiovascular risk, and we may wish to see these people again after the COVID epidemic has quietened down. If they have access to home blood pressure readings, then we can of course make a formal diagnosis of hypertension using those readings. What we're suggesting is that you should encourage the patient to use an upper arm device rather than a wrist monitor. Make sure they're nicely rested before they take their blood pressure. After all, the blood pressure will be elevated if they're distressed or immediately after exercise. We would then recommend that they put the cuff on the same arm each time and take a reading and ignore this first reading. They then take 2 subsequent readings and average those to give us a stable blood pressure reading for that assessment. We'd ask them to do this twice a day for 7 days, and when we are assessing those home readings, we would disregard the first day when we're assessing whether or not they have hypertension. If somebody is known to have hypertension, but is socially shielding or socially isolated, then we need to consider how we can manage their blood pressure. We should not just discontinue our attitude to hypertension during this COVID epidemic. So how would we go about reviewing these patients? Well, clearly, if they have a home blood pressure monitor, this will ease our restrictions because we can just ask the patient to assess their blood pressure as we've just discussed, and we can manage them in the normal way. If they don't have access to a home monitor, then the first thing we should do is see if we are over-treating them. So we must ask about hypotensive symptoms, and if there is any sign of significant hypotension, then we should reduce our intervention. If the last blood pressure reading was elevated and no intervention was commenced on their last review, then we should increase their intervention as per our normal protocol. Clearly, if the blood pressure is well controlled, then we just need to reassure the patient that they have good management. We need to support them in their adherence to medication, and we can move their review date for 6 months hence. So this brings a full protocol on how we can assess high blood pressure and hypertensive disease, even with the restrictions of COVID-19 and the fact that we may not be able to see our patients face to face. So what can we do when we contact the patient? Don't forget the basics. Encourage better lifestyle. Encourage the hour of exercise. Take the opportunity to stop those smoking who are smoking. Take every opportunity to try and find other risk factors of cardiovascular disease, and then discuss them with the patient and manage them aggressively and hopefully reduce their risk. Even though we're in this difficult time of COVID-19, we need to continue caring for our patients with cardiovascular disease to ensure that when we come out the other side, our patients are as healthy as they can be. Thank you for your attention, and if you would like any copies of the protocols discussed, please feel free to contact me at the address shown. Thank you.